Restorative-driven endodontics. Very interesting case where you will be able to see step-by-step approach from restorative planning to endodontic treatment and final preparations for indirect restorations. Let's go. Hello everyone, we are back on YouTube channel with our BG dental cases, and this time I'm going to present you very interesting clinical situation with step-by-step documented indirect restoration. The approach that we call restorative-driven endo, because from the very beginning we started with restorative part and then we went to the endodontic treatment. Despite the fact that we got a case with irreversible pulpitis and symptoms, all the time you have to keep in your mind restorative part at the very beginning, because endodontic treatment itself is a very important step, but it is a step when you do complex rehabilitation for the tooth. After endodontic treatment, the tooth has to work, has to function. So restorative part actually gives you function, and that's why we have to think what kind of restoration to do and when actually to do this kind of restoration. Before I will continue with that clinical case, I would like to remind you to sign up to our YouTube channel and not to forget to put likes to this video, because your likes will give us possibility to spread this video for many people, and many professionals will be able to see useful professional content to become better dentists, and it is free, by the way. Okay, so let's have a look. We have irreversible pulpitis for that particular tooth. This is upper premolar, and we have symptoms. We have pulpitis. We need to do root canal treatment, which is easy thing to take into consideration. Okay, but what I'm trying to say, before doing endo, we have to think about restorative part. So let us close root surface on X-ray and keep just coronal part, and let us define what kind of problems we have from the restorative perspective. We have MOD cavities. MOD always is pretty difficult situation for direct restorations. In most of the cases we have to fight between cusp reduction, cusp coverage restorations like overlays or onlays and crowns. Okay, a deep distal margin, you can see it on X-ray, pretty deep distal margin, so we have to keep in our mind. So maybe we will have to do some pre-endo treatment, like pre-endo build-up, to make our life easier when we will be doing root canal treatments. And also, in this case, we have buccal involvement. What does that mean? That means that you have composite filling from the buccal side, and you have also caries from the buccal side. So buccal side has to be involved. So having these clinical items, I would say, without removal caries even, that this tooth will be restored afterwards with indirect restoration with cusp reduction and cusp coverage technique. So the first step for this case will be taking impression, like a partial impression, to be able to have a key for provisional restoration after endodontic treatment will be finished. And the endodontic treatment for this case was not very difficult, it was pretty easy itself. The root canals were not very long, not very... First of all, we have bridge from the distal side, so the isolation for that kind of cases will be not that, let's say, classic. For this case, we decided to do a split down. It's just for the comfort. You can do first step without any rubber dam. I mean, you can remove caries, make gingivectomy if it is needed, and then you can place rubber dam. So that works. Or you can do split dam. For this case, to save our time, look what we did. We actually made few holes, few perforations in the rubber dam. The distal one, was deep. It was joined, two perforations like this. Okay, and then we also perforated other teeth. Let's say the big perforation was done for second premolar, then the normal one was done for fourth premolar, then another one was done for canine, another one was done for lateral incisor, let's say. But we were able to do split down. Why we do this split down? Again, for our comfort. With this split down, we can actually do our restorative part. We can remove caries defect, we can do our preparation. In this case, we decided that we will do indirect restoration like veneer-lay, for example. Buccal involvement and necessity to do cusp reduction and cusp coverage. So what I did, I started preparation. We actually started to do our overlay preparation, cusp reduction, opening of the interproximal box, and caries removal at the same time. So basically we prep caries and we prep for overlay. We prep caries, we prep for overlay. We clean margins, we refine margins, we open proximal box, we try to perform situation for proper pathway of insertion. And it does not take so much long time. And that approach will give us better conditions for root canal treatment. Okay, so you can see now that proximal boxes are almost opened. Now we will have to remove complete removal of the caries, because you have to do root canal treatment only after all caries will be secured and removed. We do gingivectomy. You see that we have enamel, by the way. That is important for restoration. Then I put some hemostatic liquid. I prefer to use Viscostat Clear. Then we bring back our rabidam to its own places. As I mentioned before, that we made a few perforations in the rabidam and then we went back. We used a liquid dam to secure space because we have a bridge. So to secure that this space, the zone, we use additional isolation. Then I built up distal wall to create very good conditions for irrigation. In this case, I made it without bonding. So basically I just put matrix, fill it with flowable composite, light cured, and then I have my proper conditions for root canal treatment. Why I'm saying you this? Because for this case I planned to do root canal treatment and restorative part together within one appointment. Also, we have enamel from the distal zone, and I prefer, even in deep margins, to localize margin for my restorations, my indirect restorations, in enamel, not in composite. So in this case I would not go for deep marginal elevation because we have enamel, and I was able to get access to that distal enamel. Okay, that's why I just put matrix and with no bonding restored the wall. When I will be doing root canal treatment, I will have good conditions for irrigation. After my endodontic treatment would be finished, I will just break this wall out and I will get my enamel again for indirect restoration. So let us see the next steps of the treatment. We made scouting to define what kind of root canals we have. Do we have easy or difficult or mixed root canal? Then we went for instrumentation. You can see number of instruments on the slide. Okay, it's like a crown down technique for this case because the canals were not very difficult. That's why. Okay, so we ended up with 25.4, and then afterwards we used instruments with a thinner taper, with a smaller taper. We made irrigation, and every time we made irrigation, we started to continue our preparation for the overlay. So how does it work? So we irrigate, then we prep like 30 seconds, then we irrigate again, then we prep for 30 seconds, 1 minute, then we irrigate again, and then we prep for 1 minute or 30 seconds. So basically we irrigate and prep, irrigate and prep, irrigate and prep. And actually this is the way we can save a lot of time. Irrigant will be able to dissolve pulp. We used sodium hypochlorite, and at the same time we were able to finish our preparation. So you can see now almost done. The only thing that is missing is build up or IDS, dentin sealing. covering the undercuts, and that's it. You can see now enamel from the distal side. The wall was removed after we finished our endodontic treatment. We sandblasted, we provided core build-up, and then we finished our preparation. If you're interested in that topic, we have very good online masterclass about post-endodontic rehabilitation using posts and crowns and also build-ups and overlays. Very clinical, very didactic, step-by-step online masterclass about rehabilitation after an endo. You can join this online masterclass following the link below this video in description. So feel free, you'll get a lot of tips and tricks, and you will be, you will be well upgraded with clinical information. But if you're interested in more and you would like to work with your hands, you are more than welcome to our hands-on courses here in Ukraine, in Kiev, Ukraine. So welcome to our training center. We have from endo to restore clinical course, hands-on for limited number of people, just for 6-7 people, the small group, 1 or 2 days, primary endo, retreatments, and post-endodontic rehabilitation. You will do it by your hands, step by step, under my supervision. The link to this course is also below that video. Okay, so you see that we finished our build-up, then we made some final touch for preparation, and we are ready to scan, or we are ready to take impression for the restoration and to do provisional restoration, because we have created silicone index before. So let's do some summary for that case. We planned the case from the restorative perspective. We decided that in this particular case we will be doing indirect restoration with cusp reduction technique. So we took impression, partial impression for provisional restoration. Then we started with restorative component. We prepped for overlay, we made cusp reduction. By the way, this also very useful because your endodontic treatment will be easier, because the working length actually will be shorter. Then we did endodontic treatment. During final irrigation procedures, we were doing some also preparations. Then we finished, we made build-up, and then afterwards we just went to the final steps of preparations, impression, and then we go for provisional restoration. This is restorative-driven endodontics in action. My friends, was very happy to present this case for you. I would like to wish you to be healthy, and to remind not to forget to sign up to our YouTube channel and to put likes, and may the dental force be with you. See you next time.